maybe I can start with a question from a student who has left. A student approached me during the intersection. They would like to know how the life, how the sort of soul goes into a physical form in IVF, in vitro fertilization, in the setting of without the parental or maternal emotions involved. Test tube baby. How does the life goes into the test tube baby? You know what I mean? Buddha says in the sutra that that people, well, the fertilized egg comes with a sense, with a sentient beings. Because if they are more inclined to be close to the father, they become a girl. If they are more inclined to the mother, they become a boy. There was a story told by Buddha, but what is the case in vitro fertilization? You know, test tube baby, we collect the egg from a woman, and then
so couple of years ago, when there's embryonic stem cell research, and there's lots of medical ethic issues. So this big conference happened in the University of Wisconsin about this research, and they invited all the different traditions to have some opinion into this one. So now during Buddha's period time, there's no this kind of technology, and I think there's no this question exist. So this is a very new question. So when, from my perspective, I need to understand from the Buddhist point of view, time of death and the intermediate stage, the parto, and the rebirth. So to answer this question, we have to kind of looking from these three perspectives, then particularly looking from the parto, from the Buddhist understanding or the theory. So here, the intermediate stage, the parto, this is now when there's this kind of research, when they're putting together those elements, is a consciousness, consciousness need to enter into that physical form, into that, like the consciousness is the traveler, and whatever this element was put together is like the guest house. So question is, when you are checked in, is it 11 o'clock check-in or 12 o'clock check-in? So that's the question. So when this consciousness check into this guest house, okay, and to able to know this, we have to know a little bit where this traveler coming from, how is coming from, how it comes, how is travel, this whole, how the pardo beings travel. So concept of so there's this discussion, pardo's beings consciousness, pardo's being, this being, intermediate stage being as known as I think it's like their body is unobstructed, like they kind of like go through, kind of like that kind of like a manner, and having some kind of like a supernatural power. There's a little bit description of that, but then it also gives, due to the karmic circumstances, it not able to pass through the mother's womb. That's the one situation. And one thing is that these pardos beings they're not really kind of go through some kind of like a holy places. So these two are in a literatures they give these two areas where these pardo beings are not able to. They are like us, like they need to stuck, they need to turn, Otherwise, other than that, any kind of matters and form they can kind of pass through is unobstructed. So now, if this is the case, so this explanation you're trying to bring into this research lab, okay, now is a part of those beings, because those elements, cells are not inside the mother's womb. It is into the into the plate or whatever, where they keep into nurturing. So my theory, my understanding is until these things goes inside the mother's womb, and then I think it becomes a suitable environment to the consciousness can check in. So then, of course, mind and body, the life is the part was being took at the rebirth is a kind of like a life started. So until that, that's and then basically that's where I put together. And then I think I wrote, since it's a kind of like a the university is trying to find some answers, the academic fields are, scientists trying to find the medical ethics. So I send this whole my understanding and my conclusion to private office, so make sure that I get the, to make sure I give the right answer. And I very much recall, I'm not sure what happened after that. What was what His Holiness was telling. But then, of course, this question became quite often into those public talks, medical issues, when life is beginning. So basically my theory is until into the mother's womb, this becomes kind of like a suitable environment, the consciousness to enter the into the guest house. So the life begins. Life, or the sentient beings begins. Life, concept of life is slight difference. The sentient beings begin. That I say that section of sentient beings begin.
我刚帮一个学生问仁波切，就是佛经讲的是你投生是因为父母，因为这2500年前没有这个试管婴儿，因为比如说你比较倾向于喜欢父亲这一边的话，你就是变成女孩，现在女生这一边，妈妈这边呢就会男孩，这是经里面讲的。那我一个学生请我问仁波切说，那么试管婴儿的生命是从哪来？因为他受精的那一刻是在实验室。那仁波切说，在神室好像是一个自助旅行啊，神室你必须找一个这个酒店去 check in。那 check in 地方就是让你进去有一个身体，有一个看得到摸得到的身体，那么就是扯到中阴身去哈。那么他认为说那个时候没有这个技术，所以他的理解是应该是我们在试管让他受孕以后，最终还是要放进子宫，他才会长大。就是放进子宫以后，才是开始有神识 check in 啊，就是搬进去酒店那个时候。那这个问题他仁波切想要回想达赖喇嘛尊者讲的事情，好像他并没有讲达赖喇嘛尊者说了什么，但是他说很多 public talks， 很多对公开的场合，那好像那个达赖喇嘛尊者都有描述过。不过据他的理解是，神识进入那个是必须在子宫放进子宫以后，就这样。这是我刚刚帮一个学生问的问题。
有没有问题？我有一个问题。Yeah, for either Yang Rinpoche or Dr. Lin, what kind of meditations can help patients with PTSD? Yeah, and meditation that can help remove the causes of PTSD, because I'm hearing that it's very difficult to treat. So if you have any answers to that.
What's
PTSD,
Post-traumatic
traumatic stress disorder，
啊
那个叫什么呛伤？
症候群
我刚才问的问题就是
创伤症候群
创伤症候群有什么打坐的方式可以解决，可以治疗它？
Maybe I'll talk about the medicine first. We do see a lot of post-traumatic syndrome patients. 那个看到很多after a big trauma, not necessarily physical trauma, mental trauma as well. 有的时候突然sudden loss of beloved，你爱的人突然不见了，那个 sudden loss of beloved， 那个 stress level can be categorized into 10 levels。我们医学上是把那个你的 stress 你的压力分为10级，第10级是最严重的，就是 loss of beloved， 你可能会自杀，你会 depression， 永远走不出来。You might be heavily depressed. Without appropriate guidance, you might commit suicide because you loss of drive. You lose every kind of drive to survive. And then so the first thing, 如果我们看到这种情况 if we know that there is post-traumatic syndrome, first we need to have someone around him or her 24 hours, 7 days, 24 hours. Second is 我们一定要解决他的 depression， 他的忧郁症，有很多药物，比如他的忧郁症，而且一开始 and we cannot talk about that directly. Usually this is handled by the psychiatrist， 精神科医师。We will ask the psychiatrist to come， 精神科医师来，然后会给他一个很舒适的 a very comfortable suite， 一个 room， 然后有一个他相信的人陪在他身边。他前面2周到4周是最容易 suicide 的。就算没有自杀，也有 suicidal attempt， 他会企图想自杀，但是企图想自杀，不见得 not necessarily he or she will succeed， because suicidal attempt is different from committed suicide。通常是男生一自杀就非死不可了，女生大部分是给你看，就是我想自杀，让你知道我想自杀，这样它是 attention calling。So we need to differentiate these two. If it is suicidal attempt, then we are much more relieved. 如果只是像割腕，女生大概只割0.1公分深啊，要男生就是寻死，这个个性有不一样。So for the post-traumatic syndrome, first thing is to prevent suicide, to treat the depression. And to be honest with you, all the medication in psychiatry, 精神科用的药物 all the medication are trying to suppress your emotion. So it's not really effective. 不是真的很有效。So now in US government, 3 kind of drug development have green channel to get approval. 3种药物现在在美国政府是绿色通道，就是说2年内就给你上市。第一个是 cancer, because we do not have very good drug for cancer at the moment. So if you develop a new drug for cancer, US government will approve it. If you provide sufficient data, it's safe, they will approve it within 2 years. In the past, it's 10 to 13 years. Second drug is HIV. There's no cure for HIV yet. Third drug is psychiatry, 精神科用药. So to prevent suicide, use medication to treat your depression, and a tedious, long section of psychiatric consultation, interview. 公消委每天练，就是台湾话讲练消委哈，就是精神科医师跟病人一直讲。It may not work, very very ineffective in my view. The only thing is that this patient has an insight, 他自己知道不对了。So acute trauma is easy to treat. We just help the patient to go through that period, and then he or she realize that that's not correct. Then he or she will recover. We use drug to help him or her go through the first weeks or months. If this patient has no insight, then there's no way we can get him back.